8 years ago, Laura Lee Coulter lost a massive amount of blood during an emergency C-section.
It was very scary because people started rushing in. There was a lot of blood.
Laura Lee and her son, Mason, made it through the ordeal, but it wasn't until another medical emergency before she was diagnosed with a blood disorder called von Willebrand disease. Most people have never heard of it. However, von Willebrand disease is the most common hereditary bleeding disorder.
Von Willebrand's disease is a condition that affects about 1% of the population. If you think about people at a mall on a busy Saturday, that might be 50 people walking around the mall who might not know that they have von Willebrand disease.
For those with von Willebrand, bleeding from an operation or serious injury can pose a major concern. A routine operation is what led to Laura Lee's diagnosis of von Willebrand.
My periods were getting worse and worse, and I went to the doctor and they said that I had a fibroid tumor, so maybe a hysterectomy would be in order.
Laura Lee thought that everything would be better after the operation. She was wrong.
They had nicked an artery during the procedure, and when you have a hysterectomy, you have a lot of swelling, and the swelling basically was like a clamp on the vessel, on the artery rather, keeping the blood from flowing. And as the swelling slowly started to recede over the next 4 weeks, all of a sudden, I just had a massive hemorrhage.
Laura Lee lost 60% of her body's blood supply and almost lost her life. While the circumstances surrounding Laura Lee's hysterectomy were unfortunate, they're not unusual.
It may be unnecessary for some women to actually undergo hysterectomies if their physicians were astute enough to think about the diagnosis of von Willebrand disease. The fact is that many physicians are not familiar with the disease.
Von Willebrand disease can be challenging to diagnose, but medical breakthroughs have made it easier to treat.
Socially, blood is really feared as a symptom, or bleeding is really feared as a symptom or as a sign in any disease.
Treatment options for patients include medications that can boost the body's supply of von Willebrand factor, lowering the risk of uncontrolled bleeding episodes. Laura Lee wishes doctors had found out about her condition years earlier.
Given my history, it should have been picked up decades before any of these complications had occurred. I would have another child, I would still have my uterus, a million different things, but the past is the past and I can't change that.
Symptoms of von Willebrand include frequent nosebleeds, bloody gums, easy bruising.
That guy's safe and nobody can sorry him.
If you have these symptoms and they seem to run in your family, talk to your healthcare provider about being tested for von Willebrand disease.